Laryngitis. Laryngitis is an aggravation of your voice box, larynx, from abuse, disturbance or disease. Inside the larynx are your vocal ropes, two folds of mucus layer covering muscle and ligament. Regularly, your vocal ropes open and close easily, shaping sounds through their development and vibration. However, with laryngitis, your vocal ropes become aggravated or bothered. This makes the vocal strings swell, which misshapes the sounds created via air ignoring them. Therefore, your voice sounds dry. At times of laryngitis, your voice can turn out to be practically imperceptible. Laryngitis might be brief, intense, or dependable, constant. Most instances of laryngitis are set off by a brief viral disease and aren't not kidding. Relentless dryness can now and again flag a more genuine basic ailment. Manifestations. By and large, laryngitis manifestations last not a little while and are brought about by something minor, like an infection. Less frequently, laryngitis manifestations are brought about by something more genuine or durable. Laryngitis signs and side effects can include raspiness, feeble voice or voice misfortune, stimulating sensation and crudeness in your throat, sore throat, dry hack. When to see a specialist. You can oversee most intense instances of laryngitis with self-care steps, for example, resting your voice and drinking a lot of liquids. Difficult utilization of your voice during a scene of intense laryngitis can harm your vocal ropes. Make a meeting with a specialist if your laryngitis indications last over about 14 days. Look for surefire clinical consideration on the off chance that you experience difficulty relaxing, hack up blood, have a fever that will not disappear, have expanding torment over weeks. Look for guaranteed clinical consideration if your youngster makes loud, sharp breathing sounds while breathing in, stridor, slobbers more than expected, experiences difficulty gulping, experiences issues relaxing, has a fever. These signs and side effects may demonstrate croup, aggravation of the larynx and the aviation route just underneath it. Despite the fact that croup can generally be treated at home, extreme manifestations require clinical consideration. These manifestations can likewise demonstrate epiglottitis, an aggravation of the tissue that goes about as a top, epiglottis, to cover the windpipe, which can be dangerous for kids and grown-ups. Causes. Intense laryngitis. Most instances of laryngitis are brief and improve after the hidden reason improves. Reasons for intense laryngitis include viral diseases like those that reason a virus, vocal strain, brought about by shouting or abusing your voice, bacterial contaminations, albeit these are more uncommon, ongoing laryngitis. Laryngitis that endures longer than 3 weeks is known as ongoing laryngitis. This sort of laryngitis is for the most part brought about by openness to aggravations over the long haul. Ongoing laryngitis can cause vocal rope strain and wounds or developments on the vocal strings, polyps or knobs. Constant laryngitis can be brought about by breathed-in aggravations, like compound vapor, allergens or smoke. Indigestion, additionally called gastroesophageal reflux sickness, GERD. Persistent sinusitis. Unreasonable liquor use. Constant abuse of your voice, for example, in vocalists or team promoters. Smoking. More uncommon reasons for constant laryngitis include bacterial or contagious diseases, diseases with specific parasites. Different reasons for constant dryness include disease, vocal string loss of motion, which can result from nerve injury because of medical procedure, injury to the chest or neck, disease, nerve problems, or other ailments. Bowing of the vocal ropes. Please subscribe, like and share. Risk factors. Risk factors for laryngitis include having a respiratory contamination, like a chili, bronchitis or sinusitis. Openness to aggravating substances, for example, tobacco smoke, exorbitant liquor admission, stomach corrosive or work environment synthetics. Abusing your voice, by talking excessively, talking too boisterously, yelling or singing. Intricacies. At times of laryngitis brought about by disease, the contamination may spread to different pieces of the respiratory parcel. Avoidance. To forestall dryness or bothering to your vocal ropes. Abstain from smoking and avoid used smoke. Smoke dries your throat. It can likewise make your vocal lines become bothered. Breaking point liquor and caffeine. These reason you to lose complete body water. Drink a lot of water. Liquids help keep the bodily fluid in your throat flimsy and simple to clear. Keep fiery food sources out of your eating routine. Zesty food sources can cause stomach corrosive to go into the throat or throat. This can prompt indigestion or gastroesophageal reflux illness, GERD. Remember an assortment of quality food varieties for your eating regimen. Eat natural products, vegetables and entire grains. These have a few nutrients, for example, nutrients A, E and C, that are significant for generally well-being. These food sources can likewise help keep the mucus films in the throat solid. Try not to make a sound as if to speak. This accomplishes more mischief than anything, since it causes a strange vibration of your vocal lines and can expand growing. Making a sound as if to speak likewise makes your throat emit more bodily fluid and feel more aggravated, making you need to make a sound as if to speak once more. Keep away from upper respiratory contaminations. Wash your hands frequently, and keep away from contact with individuals who have upper respiratory diseases like colds. Please subscribe, like and share.